What's been going on?
Last Sunday, he went out into the garden and collapsed in the flower bed. We thought we might actually even lose him.
Okay, so look, he's got bilateral, both sides, paralysis of his larynx. It's a bit of a ticking time bomb.
Right, so surgery it is then?
Yeah.
I'm just on my way to go and visit a very stressed family about a very stressed dog. Oberon's quite an old Hungarian Visla who is suffering with some breathing difficulties, and lately it's so bad that he can't even walk down to the practice without being out of breath. And I just hope there's something that I can do to help.
It's okay, Scott's on his way. Poor Obi.
Oberon is so unwell and struggling to walk, his owners, mother and daughter Sue and Susanna,
He's a good boy.
have asked Scott to make the special house call.
Hi, Sue.
Hi, Scott.
You're all right.
Thank
What's
you so
up?
much for coming so quickly.
It's okay.
Come in and see Oberon. He's really not very well.
Okay.
Please come in.
All
Thank
right.
you.
Will do.
Oberon's in here.
Hi, Obi. Hi, Susanna.
Hello,
How
Scott.
are you? You're
Good,
all right.
thank you. How are you?
Hello, champ. What's been going on?
Last Sunday, he went out into the garden and collapsed in the flower bed. It started off with a choke.
Coughing, yeah, and then his gums went pale and then it was going blue and he wasn't breathing.
And it was an awful, awful, desperate situation. We thought we might actually even lose him. So it was really frightening.
I can imagine. Yeah. And has he shown any other symptoms that have carried on?
Yes, well, when he gets a bit agitated, especially when there's food around and he's expecting to be fed, he sort of starts jumping about. And then he finds it difficult to breathe and starts coughing a bit. So, yes, we're very worried about him.
Has his bark changed at all?
Definitely, he's become more hoarse.
Yeah, it's much hoarser, quieter, yeah.
Yeah, it's not as loud as bark anymore.
Yeah.
Okay. Well, there's a number of possible respiratory conditions. There's some cardiac conditions, of course, it could be. But the concern that I have is that he may have a condition called laryngeal paralysis. He's got all the classic symptoms and also he's quite an old boy, and it does tend to happen in older dogs as well. The larynx is the cartilaginous box, the voice box in the throat, and the nerves that supply it sometimes fail to work. And as a result, the larynx is then unable to open properly to allow a decent amount of air into the lungs. So it means not only does his bark sound different, but he's actually unable to open his airways up enough to take in enough oxygen.
Right, yeah.
So any form of heat or any form of stress leads to this old boy having some problems. Hey, buddy. I think the fact that Oberon has collapsed in his very own garden, just doing what old dogs do, which is not much, is incredibly concerning. And I do feel that I need to take him to the practice to understand this condition more and work out exactly what we're going to do to fix it. Good boy. Out we go. Come on then, buddy. Come on.
We've had Oberon all his life. We got him when he was a puppy. If we lost Oberon, I think we would be absolutely heartbroken. We know he's an old boy, but he's so loved and he's part of the family.
Let's go to the practice. Good boy.
Don't worry, darling, be all right.
Be careful when you're picking him up, but we need him up here on the table, please.
Okay.
Good boy. Come on, yay, good lad. Well done.
At the Richmond practice, Scott needs to find out why elderly dog Oberon collapsed at home and has been struggling to breathe.
So we're going to have to take some of your blood and then we're going to try and do some x-rays. Okay, good boy, good boy, good boy.
Nurse Nathan will be assisting with Oberon's tests.
Good boy.
Chilled, aren't you, hey?
That's it. Good boy, Obi, well done. Well done.
Scott suspects the 13-year-old's breathing difficulties may be due to a paralysed larynx.
Right, okay, sweetheart. Good boy, stay still. Big boy.
X-ray.
Yeah.
But first, he has to rule out any other possibilities.
Just taking some x-rays of Oberon's chest just to see if there's any reason for his sudden collapse and his respiratory issues. So his lungs are pretty clear. His heart looks normal, so the problem isn't in his chest. Blood through yet, Nate?
Just bring them up.
Wow, he's a pretty healthy boy. Looking at the blood test, generally, Oberon's an incredibly healthy boy for 13. I mean, it's a great old age for a Hungarian Visla. I hope our blood's looking like that when I'm his age. It's pretty good. Doing the x-rays and all the blood testing that we've done has basically ruled out every other possible cause of Oberon's respiratory distress besides laryngeal paralysis.
Scott is hoping to avoid surgery on the elderly dog, so he's called his good mate, specialist surgeon Michael Hamilton, for a second opinion.
Hey, Scotty.
Hey, Michael, how are you, mate?
Yeah, I'm good. Oh, he's not as bad as I thought he was going to be.
Well,
You're paying for my speeding ticket, mate.
fair enough. Well, his owners are pretty worried. He
Yeah.
did collapse
Yeah.
at the family home a week ago.
Yeah.
And he's showing some fairly classic signs of laryngeal paralysis. So
Yeah.
his bark has changed. He's doing a strange sort of throat clearing.
Yeah.
And every time he gets excited or stressed,
Yeah.
he starts having issues with his breathing and
Yeah.
struggles to get breath.
Yeah, change of barks, highly suspicious.
Yeah.
Can I just have a quick listen to him?
Absolutely.
Yeah, he's pretty raspy around his larynx, isn't he?
Good boy.
He's nice and relaxed on his meds, isn't he?
Yeah,
But a little charge around the park and he goes blue, right? Yeah.
that's pretty much it.
You got his x-rays and things?
Yeah, so we've taken some chest x-rays. They all look fine.
Yeah.
But what we need to do, of course, is give him his anaesthetic. So I thought I'd wait for you.
Yeah, and have a look.
Before making a decision on whether or not to operate, Scott and Michael need to have a close look at Oberon's larynx to see how well it's functioning.
Okay, sweetheart.
For this, he's been given just a light anaesthetic.
To fully assess Oberon, he needs to actually be awake, which does mean that he can bite down on our hands as we're checking him over. Watch your fingers, because it's going to be quite light.
He will be chompy, so...
Okay.
So look. So when he breathes in, what should happen is his airway should open.
Yeah.
If it's paralysed when he breathes in, he sucks it closed. So, Nath, tell me when he's breathing in and breathing out. So go in and out as he breathes in and out.
In, out. In,
Yeah, it's not doing much.
in.
Looking down this dog's airway, there's no movement at all. And so as he's trying to breathe, his airways should be pulled open. But actually what happens is they just sit there. And as he breathes and sucks air in, they actually get sucked closed. So he's got bilateral, both sides, paralysis of his larynx. And dogs can die from this. So it's a bit of a ticking time bomb.
All right, so surgery it is then?
Yeah, sure. Right.
Okay.
I'll go get changed, mate, if you go
Yep.
tube.
We'll do.
See you in a
All
sec.
right, see you in a second.
Oberon will now be given a full anaesthetic, and Scott and Michael can immediately proceed with the delicate surgery.
The procedure that we're going to be performing today is called a laryngeal tieback. It's a very complicated procedure and it comes with lots of risks.
I'll just be there to tell you to cut that cricotrypnoid.
Yeah.
That's the only scary bit, really.
Today I'm going to be the lead surgeon, but Michael is very much my able right-hand man.
So keep feeling for that wing of the thyroid, because that's basically where you're aiming. That's where you need to go to. There's some big things in there, jugular veins, big nerves. So yeah, you just got to make sure you know where you're at.
I'm ready to go.
That's it.
Just want to cut that.
Yeah, and then a little bit backwards. See that little fella?
Yep.
Don't want to cut that.
No.
That's the branch of the jugular, so I'll get him up here out the way. There you go. Now for the really scary bit. So you've got your process there. And if you put your finger just behind that muscular process and there's a little depression, that is actually the joint that you're going to disarticulate. And then we're going to stitch the arytenoid in a different place.
Yeah.
But it's quite a tough joint, but it's a joint nonetheless. You need to just free it up a little bit. So just use your forceps on there and then just cut forwards just a little bit. That's it. That's lovely. Nice work, sir.
So we're at a pretty pivotal stage of the surgery. What we've done is separated the inner bit of cartilage, which means that I can now grab hold of the muscular process we uncovered and actually then lasso it to that middle cartilage. And by doing so, we're opening up the larynx and pulling away that vocal fold away from the centre.
That's
Yes,
it.
that's it.
Nice. So you just got to tie it now, and that's it.
Yep.
I'm just going to hold that ever so gently, like finger on a parcel. Done.
Nice.
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 Happy with that.
Nice,
Or
mate.
as the Geordies say, lush. So there is our laryngeal tieback, a massive surgery with lots of complications, and all it boils down to is just one little suture that's going to make all the difference in the
Yeah.
world.
Good job. Looking good.
I'm just closing up, so yeah, Oberon says thank you, and so do I, but you can head off.
No worries. No worries.
Thanks, mate.
Okay, all good. Mate,
Nice working with you.
I'll see you soon. Bye, mate.
See ya.
It went well. Didn't cut any white stringy things, as in the nerves. So best case scenario, future for Oberon is he will wake up and can't believe how well he can breathe. Within a couple of weeks, just when everything's settled down, he's flying around the park like he never has done before.
Okay, now to see if the job's done. Oh yeah, look at the difference, that's massive. It's a massive relief to actually see that his larynx is now much more open. This is an old boy that's had a great life, and I want him to have a life going forward. And he can only do that when he has an open airway. And now, thankfully, he does. That was a long one, wasn't it, mate? Hey?
Oberon will spend the night under observation at the clinic to make sure he's fit enough to go home to his owners in the morning.
You huff and you puff, old boy, hey? At least you can breathe now. Yeah. No more collapsing for you. Oh, yum. Good boy, well done. You're breathing very well this morning, aren't you? Hey? Yeah.
Oberon is recovering well from his big surgery.
Good boy. Hey? Wouldn't know you've been through a major surgery. Hey? No, you wouldn't. No.
Yesterday, the 13-year-old Visla underwent a risky throat operation to correct the paralysed larynx that was closing his airway.
Yes. Wait a minute. There we go. You got very nice table manners. Good boy. Yeah. Take it nice and easy. Yeah. Mummy and Grandma will be here soon.
So excited about seeing him.
Yeah.
Owners Sue and Susanna have arrived at the practice and can't wait to take their old boy home.
Hello.
Hello.
How are you doing?
We've come to pick up Oberon.
No problem.
Yeah,
Oh,
thank you. Thank you very
Shortly.
much.
All right, cheers.
Last night was terrifying. We were really nervous, waiting to hear how he was, how he's pulled through. Can't wait to see him. So excited.
What's this?
Here he comes. Oh, sweetheart.
Hi, guys.
Hi.
And here's your boy.
Hey, baby.
Hey.
Hello, baby.
Oh, yes.
Hello.
Who's that?
Look at him, my lovely.
So he's done very, very well. He's obviously going to still be making a little bit of noise after the surgery,
Yeah.
Hey.
just because of the fact that he's had a tube down his throat and also major surgery on his neck. But I'm very happy with the result. The surgery went really well, and now his larynx is tied back on the left-hand side. So it's basically like if he's got sliding doors, one sliding door is now pulled in the open position all the time. Now that Oberon's going home, he does need some very specialised care because basically he has an airway which is permanently latched open. So he is exposed to the possibility that he could breathe in food and cause severe distress. And so one thing Sir will be requiring is his food needs to be now hand-fed.
Yeah.
You need to roll it into little balls and he's going to be fed at head height. So you get the royal treatment you are, yes. Hand-fed by your own personal butler service. Yes. But other than that, this old boy should make a full recovery and be bounding around the parks of Richmond very soon.
Such an almighty relief, isn't it?
Hey, you're not perfect, but you can breathe.
Yeah.
And that's all we want. That's all we want, isn't it? Yeah. All right. Bye, buddy. Take care. We'll see you soon. Bye, buddy. See ya. Bye. See you later. Take care. All the best. See ya.
Thank you so much.
Bye.
Bye-bye. Come on, boy. Boy, come on, this way. Come on. That's a good boy.
Hi, I'm Dr. Kate. If you enjoyed this video, don't forget to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content. And if you love Bondi Vet, go and support us by checking out Bondi Pet Marketplace at bondipet.com. You'll find a whole range of great Aussie pet products and services. We can't wait to see you there.